About 7 hours so far.
Excuse me, we have someone who is in the waiting room. Would you like me to admit them?
Who might that be?
It says Azlan, A-Z-L-A-N.
I'm not familiar with that person.
Is it, Mr. Shirley, do you agree to not admit that person?
Well, I think we need to find out who it is. If it's somebody from a legitimate news agency, to leave the others admitted, and to exclude that person may result in actions that we don't anticipate or desire.
Okay, I'm going to admit them and ask them who they are, please.
The prosecutor's
Court reporter, we have someone who's just logged in, A-Z-L-A-N. Could I have your name, please, sir? Or ma'am? Oh, connecting to audio.
Dude, I know mine.
This is admitted, Azlan, A-Z-L-A-N. Could you please give me your name, please?
Dude, she's gonna.
This is disruptive, and that any further attempts to admit themselves to this deposition they'll be excluded.
Absolutely.
Okay, we can't keep doing this.
Thank
We'll be
you.
here
Yeah.
all the evening.
Been adequately addressed.
Thank you.
Madam Court Reporter, we're going to start off with a new question. Dr. Rubino, how were you contacted in this particular case?
Wendy Perez contacted me, or Kevin. Let's see. Wendy Perez.
Okay, when were you contacted, sir?
In March.
Were you asked to do anything back in March?
I was waiting for a report, as best I can remember, but that report never got done. So I didn't get anything done until he was actually convicted.
Okay. Next question I have for you, sir, is what percentage of your income is from legal work as opposed to clinical?
Roughly 10%.
So you're currently seeing patients?
Yes, I am.
All right. Have you authored any treatises, articles, or textbooks, sir?
I have not.
In this particular case, could you please advise me as to what materials it is that you were provided to review?
Department of Juvenile Justice face sheet. Basically, Justice Investigation Services, Shirley Wilson, investigation, case report. It looks like it's some work that was done by Shirley that was investigating.
Okay.
Tunda Wilson, Lee County Medical Records, Part 1 and Part 2. Wade Wilson Medical Records 1, 2, 3, 4, and 5. Wade Wilson letter
I'm sorry, who will?
Wade Wilson letter,
Thank you.
Wade Wilson school records, entitled Wade Wilson documents. And then double files of Armor medical records, which are just duplicates of the ones I just mentioned.
Okay, so just so that I understand, you said you had a criminal justice face sheet, you said you had a case report, you had a series of medical records, you had a letter from Mr. Wilson, and you had his school records. Is that accurate?
It's accurate, yes.
All right. Anything else, sir?
That is all. Well, I have his imaging.
And that was what was just conducted. Is that right?
That's right.
Okay, and I'm assuming that also includes the CT scans from April of 2023. Is that right?
Give me a second. Yes.
All right.
Maybe
Now,
it
when you say you received medical records, are those the records from the jails?
I didn't find them useful, so let me take a look here. Yeah, it's all armor.
Okay.
So everything is from jail.
All right, fair enough. Did you meet with anyone or consult with anyone to come to any conclusions in this particular case?
Say that one more time. I missed the first part.
Yes. Did you meet with anyone or consult with anyone to come up with any of your conclusions in this particular case?
I met with Wade Wilson as well as the defense team.
Did you speak to a Dr. Eisenstein?
That's his report I was waiting for, but I don't recall. I might have, but I don't recall listening. I talked to Eisenstein about other things, so I'm not sure if I talked to him about Wade Wilson.
Okay. Did you speak or review a report by Dr. Hyman Eisenstein?
Not that I recall. I have nothing in my records. So I didn't have any. I had no reports,
Okay.
and I don't remember talking to him.
Okay. Did you speak or review any reports made to you regarding Mr. Wilson from Dr. Mark Mills?
No.
Did you conduct any of your own tests or examinations upon Mr. Wade Wilson?
Yes.
Okay. What exactly did you do as it relates to any tests or examinations upon Mr. Wade Wilson?
I performed a neurological examination of Mr. Wilson.
And how did you go about doing that?
I must say it was challenging because he was under restraint most of the time when I was trying to examine him. Basically, I did a test called a MoCA, Montreal Cognitive Assessment Test.
Okay.
And then I evaluated his cranial nerves, which is I evaluate his the look in his eyes, his pupils. I check his extra ocular movements, check the sensation of his face, I check to see if his face is symmetrical. See if his tongue comes out straight, whether he smiles straight. And that's all I can really check in the situation we're in.
Okay.
Then I'll do a motor examination, which I'll check his strength, which is challenging to do when he's restrained like he was.
Mm-hmm.
Check his sensation, his deep tendon reflexes, his coordination by doing a finger and nose test, evaluate his gait, as well as assess Romberg or not. Romberg is where I have him standing with his feet together and he closes his eyes.
Okay. All right. Let's take this one at a time, Doctor.
Yes.
You indicated that you initially spoke with Mr. Wilson and had a consult with him. Is that correct?
I initially did the exam first, which is backwards because the way the jail was set up. Usually I
Okay.
talk to him first because I like to know what I'm looking for. Here I had to kind of do it things blind, where I was examining him, then I took a history.
Okay. So you're telling me that you went ahead and conducted the neurological exams before you went ahead and had a consult with Mr. Wilson. Is that right?
That's correct.
And what did you begin with first?
Montreal Cognitive Assessment.
All right. Let's talk a little bit of Montreal cognitive assessment. How did you go ahead and have him perform or conduct the Montreal cognitive assessment test?
I have a sheet called Montreal Cognitive Assessment, and I put it in front of him with a pen, and I ask him to start with trails, which is the first test.
Mm-hmm.
And then I give him the directions on how to do it, and he does it. Then he's got a copy of a cube,
Yep.
and then he has to draw a clock with numbers on it, and then put time on it.
Okay.
You want to go to the next section?
Yeah, I believe the next section is a series of animals.
He named those correctly. Lion, rhinoceros, and camel.
Mm-hmm.
He's asked to remember 5 words. Then he's asked to repeat 5 numbers in forward order and 3 numbers in reverse order. Then he's supposed to read I'll read a bunch of letters, and he's supposed to tap every time he hears the letter A. Then he does serial sevens from 100, which is subtracting 7 by 100 and 7 from that, 7 from that. Then he's to repeat a sentence after I tell it to him exactly. Then he has to give me as many words that begin with a certain letter. That letter is F in 1 minute. Then he has to, excuse me?
He has to basically tell you the similarities between various items, and then you give him a delayed recall examination test, which indicates he has to recall certain words: face, velvet, church, daisy, and red. And then
Yes.
he has to go ahead and determine his orientation. Is that correct? Which is basically by telling us the date, month, year, day, and place and city. Is that right?
Yes.
Okay. How did Mr. Wilson perform on the MOCA test?
He scored a 22 out of 30.
Okay. And what did that indicate to you?
It indicates he has impairment.
Why?
Well, the impairments are in executive and memory.
Well, can you tell me exactly what name and describe the specific test from the MOCA that revealed that he was impaired in the executive function and delayed memory?
His cube was horrible. It was nowhere near a cube. The clock, the numbers were not completed. Contour of the clock guy actually isn't that good, but I give him credit for that. And he put a time on it that wasn't the time that was told. Actually, you just kind of put X in the middle.
Mm-hmm.
So they'll give him a 3 out of 5 or 2 out of 5 on the executive function. And then on delete recall, he's only able to get the velvet out of the delete recall.
Okay.
And then on orientation, he didn't know what day it was. He knew it was a, I forget when I saw it. Let's see when I saw it. I'm on August 9th.
Do you know whether or not the MOCA has any internal validity measures, Doctor?
It does not have any internal validity measures.
Okay. Well, how do you determine whether or not the person is giving good effort?
I think he was giving good effort because he gave me 12 words in a minute, which is a cutoff is 11, so he did good on that. He did serial sevens, which is hard to do. So things that he could do, he did. I have no reason to believe that he would not remember something on purpose and then not fudge something else. He did good in the middle of the section, but he failed on the executive and memory. So,
well, how does MOCA assess the memory function?
You remember 5 words, you do something else, you come back and repeat those 5 words. That's short-term memory.
And how many did Mr. Wilson give?
1.
Okay. Well, how do you know that you didn't actually remember more without the internal validity check?
I really don't know that because there's no validity check. However, why would he do 100% on serial sevens and words and then say, hey, I'm not going to remember these words. I'm going to start faking it.
Well, you agree with me, sir, that he could also be deceptive during the test and give you false answers. Isn't that correct?
He could be deceptive. Yes, he could give me false answers. That's correct.
All right. Well, would you say that the 10-minute MOCA was a better measure of cognitive function than 6? And sir, isn't the MOCA a screening instrument that essentially takes less than 10 minutes to administer?
It is screening, but I'm not a psychologist. I'm a neurologist screening for cognitive dysfunction.
Well, are you certified in administering that particular test?
I'm not actually.
Okay. Are you familiar with the fact that successful completion of the official training and certification is mandatory for anyone who administers a paper-based MOCA test according to the MOCA Cognition website?
It's run by a doctor who makes you pay all his money. I signed up for it, but then I couldn't get back into it. So it's kind of a racket.
Okay. So you're not certified in administering that. Is that correct?
I'm not, but it's science to do this test.
I'm sorry, I didn't part. You said I'm not, but.
It doesn't take a rocket scientist to do it.
Thank you.
All right.
I ain't certified in the rest of my neurological examination, which I'll gladly put forth.
All right. Well, we'll get to that, sir. Is that all we were able to determine as it relates to the Montreal Cognitive Assessment Test, sir?
That he
covered everything there?
That he has some cognitive impairment. Yes, that's all I was able to glean from that because that's all it's powered to do.
Okay. And we can't determine whether or not any of his responses were valid or not because there's not an internal validity test to that particular assessment. Isn't that correct?
That is true.
All right. All right. Now, the next test you indicated to me was that you conducted a cranial nerve test. Is that correct?
Yes.
And what exactly is involved in the cranial nerve test?
I will check his pupils to see if they're responsive to light equally and symmetrical. I will check his extraocular movements. I will check his facial sensation, facial symmetry, and with smiling. Whether he can hear my fingers rubbing on each side. That's 8, 9. Check his palate if it goes up straight. Check to see if his tongue goes out. And then I'll check his shoulders if he shrugs asymmetrically, which is cranial nerve 11.
And how did he perform on your cranial nerve test?
On his extraocular movements of his eyes, he has horizontal jerk nystagmus bilaterally.
Okay, and what does that indicate to you?
That indicates that he has a problem with his vestibular ocular movements. So it can mean that he has a problem with his midbrain or vestibular apparati.
Or his what?
Vestibular apparatuses.
Thank you.
Okay, and what would give rise to that issue?
Typically, head injury does.
Okay.
But having a cold or something like that can also do it, but he did not have a cold.
Okay. Is there anything else that would give rise to that, sir?
Possibly Meniere's disease. But he had hearing loss. And they reporting ringing in the ears. So he didn't have Meniere's disease. And or acute intoxication with alcohol. I'm pretty sure he wasn't drunk.
Okay. What about prescription medication? Would that give rise to that as well, or no?
Let's see what he was on. Not aware of lithium or Paxil causing anything like that.
Okay. So you're attributing his cranial nerve testing showing the horizontal jerk nystagmus to brain injury. Is that correct?
That is a strong possibility, although, as you mentioned, it may not be from that, but I'm just putting that in the same
Okay.
category.
So it could be from something else.
It could be from something else, yes.
Fair enough. You also indicated that you conducted what's called a motor exam. Is that correct?
That's correct.
And you indicated that he had normal strength but exhibited a cogwheel rigidity on his right.
Oh, you got that in my report. Yes.
Yes, I did.
Cogwheel rigidity is something you see commonly in people who've been exposed to antipsychotics.
Okay.
That tells me that he was exposed to some antipsychotics at some point in his life.
Is there anything else that would give rise to any issues relating to his motor exams?
That is it for tone and motor.
Okay. You also indicated you had some difficulty because he was restrained. Is that right?
Because he was what? Restrained? Thank you.
Yes.
Yes, it was hard to examine him. And most of the stuff I was able to get done, though.
Well, it was hard to examine him, sir. And if Mr. Wilson had difficulty due to restraints, how can you rely upon his motor exam and muscle tone as it relates to your ultimate conclusion that there was some kind of brain injury?
Because I worked my way around it.
Okay. How did you work your way around it?
I had to have him remove one arm at a time. It just took longer.
And that didn't compromise your assessment?
No, it did not.
Okay. You also indicated that you conducted what's called sensation or a deep tendon reflexes. Can you please describe for me what exactly was involved in that?
Deep tendon reflexes are, I bring up my reflex hammer and I tap on tendons of his arms, his knees, and his ankle jerks. The tendons in the arms are going to be the brachioradialis, biceps, and tricep. Patella is going to be the knee, and ankle jerk is the Achilles tendon.
And you indicated that there are brisk and ankle jerks are normal.
Yeah, his arms were
patella and his ankle. Is that right?
His arms were decreased, his patellas were increased, and his ankle jerks were normal.
You also indicated that his gait was normal on the coordination testing.
His gait was normal. In coordination, he had on finger and nose, he had some pass pointing on the left side. It means I have him touch his nose and touch my finger as I move my finger, and he shot past it a couple times.
Okay. And what would that indicate to you?
A coordination problem on the left side.
Okay. And what would give rise to that, sir?
Left cerebellar injury and any inputs from the cortex to the left cerebellum.
Okay. Would there be any other causes, sir?
He decided to start faking again.
Okay.
I'm just that cerebral problems may have some to do with antipsychotics, just because those are very the dangerous drugs.
Mm-hmm. So after you performed all of these various tests, you came up with a conclusion that you drew that he had several significant head injuries, but you have no records to support them. Is that correct?
This is correct, but this is common in people in the criminal world. They hit their heads hit, they're either on probation and they don't want to go to doctors, or they're not they don't think they're really hurt that badly when and actually they think they're hurt badly. They just don't go to doctors because they don't get arrested or don't have insurance or some reason. They lack records. And a lot of times they may have gone to doctors, but sometimes the records are so old that no one has them anymore. But he has no record because.
But you actually drew a conclusion. You drew up a conclusion that he had traumatic brain injury. Is that correct? Just based upon his performance on the Montreal Cognitive Assessment, his cranial nerve tests, the motor exam, and his deep tendon reflexes test. Is that right?
I didn't diagnose him with traumatic brain injury as of my summary. I said he had evidence that supported that injury, traumatic brain injury.
What did Mr. Wilson tell you as it relates to any of the head injuries?
The first thing we talked about that he was about his childhood. I was looking for head injuries in his childhood, and he said he was good until about 11, until he told his parents that he thought he was going crazy. Then he told me about a car accident in Tallahassee. He was a passenger, and the driver rode off the highway and hit an oak tree. He knows he hit the windshield. He was brought to Tallahassee Memorial Hospital, but left AMA.
Mm-hmm.
But I have no records about that. And then second car accident, he was on probation and he was at the beach with friends. Took the dirt road back, into the back seat. And again, the car hit a tree. Everybody got knocked out. When he woke up, he started to run because he was on probation, didn't want to get arrested. And then he felt bad and went back to the EMS to get evaluated. And then he just left because he didn't want to go to the hospital.
Okay.
They asked about sports. So he had two times when playing football, or one time when playing football where he got knocked out, and one time playing baseball he got knocked out. He ran into something. I can't read my rating. But since there's no records, I'm not going to try to read it. Then he's been he got with fights. Another thing. So he never got knocked out when he was in a fight unless he got jumped. And he's been jumped approximately 3 times, in which he got knocked out each time.
Did you bother?
Go ahead.
Go ahead. I'm sorry. You were saying?
Then he told me about his biological parents. That his mother was only 14 when she had him, and was using drugs when pregnant with him. She used drugs all the time. That's why he assumes that. As the father was as well.
Is it fair to say that is all information that was provided to you by Mr. Wilson? Is that right?
Yes, it is.
Okay. Did you bother to look up any records or make contact with any of the individuals that he had mentioned in his self-reporting to you to corroborate any of that information?
He didn't mention any individuals other than his biological parents.
Okay. Have you spoken to his biological parents?
I have not, because I'm not going with drugs. Just a comment that I noticed, or that I took in.
I'm sorry, I didn't hear the last part of what you said. I have not, because I'm not going with drugs, and then I didn't.
Not part of my content.
Thank you.
Are you familiar with any of the occupants that he had been riding around with? Did he give you any names?
He did not.
And where this all occurred?
Tallahassee. But I don't know any occupants.
He didn't give you any names as to who that was?
He did not.
He didn't tell you where this occurred other than it happened up in Tallahassee?
Now, the second one was coming from the beach on back roads. And since there's not beaches, a little bit distance from Tallahassee, that was probably Panhandle Beach.
Okay. Did he give you a date and time, any type of location, or was he just very general and vague?
Can you give me dates other than years ago? It's very indiscreet with time.
Okay. You would agree with me he was also very indescriptive as far as location goes?
That would be reasonable as well.
Okay. Did he tell you when he played sports and when he sustained those 2 concussions?
High school.
Okay. Both times?
Both baseball and football.
Okay. Did he tell you what years in high school?
No, that's something I could look up though.
Okay. Did he tell you when in high school?
He did not.
Did he tell you how in high school?
The baseball, he ran to a tree or something like that, or ran into something, got knocked out.
Let me ask you. He ran into a tree while he was playing baseball in high school.
Ran to the fence or something. I can't read my writing. They
Okay.
ran to something, and he says he got knocked out.
Okay. But you don't have anything to verify or corroborate what he's telling you as it relates to that, correct?
I do not have anything to corroborate any of this, right?
All right. You also note and that he reported to you that he had some kind of vertex headache if he shakes his head. Is that right?
Yes.
And he complained that he has chronic neck pain.
Yes.
What exactly, can you please describe for us what chronic means?
Chronic means that it's been present more than 6 months.
Okay. And what percentage of people with head injuries report chronic neck pain?
A majority of them do.
Okay.
I don't have exact specific because I need to look it up because I don't do my statistics. But in my practice, everyone that I've ever seen with head injury also has neck injury because the head is attached to the neck.
Well, are there any other causes of chronic neck pain?
Age, degeneration, congenital problems.
Well, do you have patients that have chronic neck pain that don't have single head injury?
I have people with whiplash during car accidents who didn't hit their heads, but got their neck whips. So typically they have neck pain. So you have neck pain without head injury. But if you have head injury, you usually have neck injury too.
Okay. But you can have chronic neck pain without having head injury. Is that right?
You can't have that, yes.
All right. What about chronic headaches? Can you have a chronic headache without having a single head injury?
Yeah, you can have migraines just from bad genes. You can have caffeine overuse headaches. You can have stress-induced headaches. Having chronic headaches isn't confined to having head injuries, but head injuries definitely increases the risk of having a headache.
All right. Let me ask you this as it relates back to the 2 concussions they sustained while playing sports. Was there ever any medical care for any of those concussions that he supposedly sustained while playing sports? That you're aware of?
I'm not aware of any.
Okay. All right. Now, do you have any evidence as it relates to any knockouts from the fights that he sustained?
No, I do not have any evidence of.
Okay, so you don't have any medical attention that was ever reported as it relates to that. Is that right?
I'll make this quick. There are no medical reports of anything with him that are outside of being in jail.
All right. Fair enough. All right. Now, doctor, let me get to your request for the CT scans and the MRI scans. You had an opportunity to review those scans?
I hadn't requested the CT scan. I'd requested a CT PET.
Okay. Well, you received a series of scans. You received the CT scan from April 23rd of 2023 that you acknowledged earlier in the deposition, and you also received an MRI scan from August 21st of 2024. Is that correct?
Right.
All right.
I did not receive a neuroquant analysis or any kind of analysis of DTI. It was just DTI without any kind of analysis. Computer analysis.
Now, what did you learn or ascertain as a result to the scans that were conducted on August 21st of 2024, so just a few days ago?
His MRI shows mild ventricular asymmetry. Ventricular asymmetry results in cognitive and emotional problems in the setting of psychiatric disease.
Okay.
That's one thing. Also, I did not have neuroquant, which would show this ventricular asymmetry, as well as one of my impressions of his brain was that his ventricles were overall small. Whenever you see small ventricles in people, it suggests that they have increased intracranial pressure, which could be why he has chronic headaches. And that the bulk of his brain doesn't have any atrophy, except you start seeing some atrophy in the frontal lobes, as well as the anterior temporal lobe. But overall, his brain looks good, other than this little bit of atrophy he has in his anterior temporal lobes and his frontal lobe, which is going to be impairment in executive function, and impairment in memory, which kind of reflects that MOCA we just did.
Okay.
But with the temporal lobe, you also get emotional unregulation.
Now, you said the ventricles were relatively small?
The ventricles are relatively small. I mean, compared to other age-matched controls I have, and his ventricles are small. They're asymmetrical, but overall they're smaller than typical. In my experience, if I were to get a PET scan with people with big brain and his activity, PET scan would be markedly abnormal with big brain, but doesn't work. He's not a genius. But I do not have a PET scan.
And what exactly did you say regarding his frontal lobes?
He has mild atrophy of the anterior portion of his frontal lobe, as well as the bottom part, the inferior frontal cortex, the orbital cortex.
Okay.
You see the space between the gyri.
Okay. And what does that indicate to you?
This indicates that some of the head injuries that he told me about were likely true, because you see atrophy in these areas of the brain when you have head trauma, because it's the area exposed to skull and deceleration injuries.
And you're saying that based upon his upon these scans that you're seeing sites of atrophy?
Mild atrophy. It's not a ton of atrophies. So this is going to be, he's still relatively young. I think as he gets older, this is going to get worse. But as a result, this is indicating that these parts of the brain have been affected by head trauma.
What about the axial grayscale images? What did you see there?
The gradient echo?
Yeah.
mean for bleeds?
Yes.
I saw no blood. No, there's no evidence of hemorrhage prior to this, or prior.
Okay. Did you see any cerebral infarctions?
No cerebral infarctions. He's also a young guy. Why would he have a stroke?
Was there any other MRI findings to suggest deceleration injuries to these areas?
I'm going to show a couple images from DTI that show a lack of coloring in part of the left frontal lobe.
Okay. And what would give rise to that?
What usually gives rise to it would be axonal damage, which would be from head injury. But you can also see it in white matter disease, but he has no white matter disease.
What about drug use?
Drug reuse would cause symmetrical whole brain problems because drug affects the entire brain. The only drug I know that causes atrophy would be alcohol. The other drugs would affect neurotransmitters, and that's why that PET scan would have been a lot more useful, is to see what his brain had, what happened to it, because that tells us more of a function, where MRI just tells us structure. MRI is all about structure.
Now, doctor, when we're talking about the CT scans that were taken back on April 7th of 2023, Mr. Wilson was taken to the Lee Memorial Hospital, and he had a CT scan done, and those were provided to you, as well as the MRI that were just taken back on August of this year. Did you have an opportunity to review those scans as well?
I reviewed the scans as well.
All right. You also had the opportunity to, as you indicated earlier, that you had an opportunity to review the jail medical records, which would have included the Lee Health records as well. And in those records, there was a report that specifically found that the ventricular system was normal for Mr. Wilson's age. There was no acute intracranial hemorrhage, mass effect, or midline shift. No extraaxial fluid collections were present, and no territorial hypodensity to suggest acute infarct. The paranasal sinuses are free of significant mucosal disease. The skull base and calvarium are intact. The impression was there was no acute intracranial abnormality. What do you make of that, doctor?
It's a negative CAT scan.
Right.
If you look at it, you can see the ventricles are not the same.
I'm sorry?
You can see the ventricles are asymmetrical on the CAT scan as well.
Mm-hmm.
Does it constitute something in an emergency room? You call it abnormal? No. It's not something that you'd call in a radiologist would call in the hospital. Because they're not really, it doesn't constitute a disease. But it's important if someone has a psychiatric illness.
Okay. But you indicated to us earlier that you weren't evaluating him psychiatrically. Is that correct?
No, but I've seen that he's been treated for psychiatric disease. And the medications he's on, lithium, suggests he's got bipolar disorder.
Hmm?
And bipolar disorder, from what I understand, is a psychiatric disease.
Okay. What do you know about bipolar disorders, doctor?
It's treated by lithium and Depakote as the two main drugs. It's a mood condition characterized by low mood, depression,
My what impression, please?
low mood or depression,
Thank you.
and then followed by hypomania or mania, elatedness, which then sometimes can turn into psychosis if the mania is left untreated. So you have manic with psychosis. You control the bipolar, then you don't see psychosis at all.
And you'd agree with me, sir, that you're not a psychiatrist. Is that right?
I am not, but I am boarded by American Board of Psychiatry and Neurology. In neurology.
Okay.
So there's a little crossover.
So you rely upon the DSM-5 on a regular basis?
No, I'm not a psychiatrist. I'm a neurologist.
Right. Now let me ask you this: when we have a CAT scan that reflects that Mr. Wade Wilson's brain essentially is normal according to the radiologist, and then you apparently a year later come up with a conclusion that he has traumatic brain injury, how do you reconcile the two, doctor?
Well, first of all, a CAT scan is not really powered for looking for TBI unless you have bleed in it. If you have blood in a CAT scan, that's something, but if it's negative, you're not really seeing a whole lot because you can't see differentiation between white and gray matter. It's basically a fancy X-ray. MRI, radiologists are looking for disease. This test did not have neuroquant, didn't have any computer analysis of atrophy, had no computer analysis of DTI, and the findings are mild. They're not overt to where radiologists can say, "Oh, there's pathological atrophy here." They're not going to say that. That's just the nature of radiologists.
So, doctor, is there routine evidence that would support clinical use of advanced neuroimaging techniques for diagnosis and or prognostication of traumatic brain injury at the individual patient level?
Ask the question again.
What I'm asking is there sufficient evidence to support the routine clinical use of advanced neuroimaging techniques for diagnosis and or prognostication of traumatic brain injury at the individual patient level?
It's the only test we got. We don't have anything to show anything else. I think in time we'll have better technology such as tau PET, which will actually be very useful for traumatic brain injury, but that's not commercially available right now. All we have is what we have here, and so we use the tools we have to best prognosticate the best we can. But okay. Nothing is 100%.
So, doctor, for patients presenting with an acute traumatic brain injury, what remains the imaging of choice?
Acute brain injury, a CAT scan, because you want to make sure there's no blood on it. We don't know the level of TBI. We don't know if there's a subarachnoid hemorrhage, an epidural hemorrhage, a intraparenchymal hemorrhage. Once we exclude that and there's no hemorrhage, people can still have TBI. That's why we do an MRI. MRI by itself is typically not that useful in the acute phase, whereas DTI is then used because that is useful for acute head or subacute traumatic brain injury.
Now, when we talked about the CT scan, you indicated that asymmetry would be reported.
No, it's not going to be reported by a radiologist, but you can see it on the CAT scan.
Okay. Did you observe any on the CAT scan?
Yes. There's mild atrophy of this lateral ventricles.
Okay.
Or lateral.
And what would that suggest to you?
The asymmetry of the lateral ventricles supports cognitive and emotional difficulties and people with psychiatric disease due to myelin being unequal.
Would it also suggest a shift due to a possible pathological process?
No, pathological process would cause shift of the entire hemisphere, not just make one ventricle bigger than the other. This would be ventricle is bigger because of the less brain on that side, loss of something on that side to make that ventricle bigger.
And doctor, if the myelin was unequal, wouldn't that show up on the DTI?
I don't think so, because we're looking at axonal pathways, and the axonal pathways shouldn't be affected too much. I have to look at it, see there's a paucity there. I don't actually know the answer to that question.
Okay, fair enough. Doctor, when I'm looking here at your request for the radiology order, you specifically indicated that you did not wish to have any of the studies interpreted unless mandated by the institution. Is there a reason for that, doctor?
The radiologists read it for disease. They're not looking at it from a criminal perspective.
A criminal perspective?
Looking for traumatic brain injury from explaining behavior point of view. And also, I've had radiologists miss things at times, in which case I have a hard time getting that beat up or thrown out because it's obvious and they missed it and I can't get it changed. So I just rather have them not do it at all.
Okay, well, but in this particular case, you actually did receive a record from Lee Memorial Health Systems regarding the CAT scans supporting what they had observed on Mr. Wilson back in April of 2023. Isn't that correct?
The CAT scan is negative for acute injury.
Okay.
So that's all there is to it. And I agree. There's no acute injury there. There's no blood on it. That's all you can see from a CAT scan.
And are you essentially telling us that you're more qualified than a radiologist to read these CAT scans, doctor?
I'm not arguing with the radiologist.
Or to read the MRI, doctor?
Some radiologists, yes, not all radiologists. There's some good radiologists out there.
Okay. Well, are you familiar with a doctor by the name of Joseph D'Alonzo?
I do not know Joseph D'Alonzo. Who is Joseph D'Alonzo?
Okay. Well, he's a doctor. He's a radiologist who read the CT scan without contrast, who indicated that there was no acute intracranial abnormality in Mr. Wilson.
And that statement is correct. It is true.
So, taking us back to Mr. Wilson, what is your conclusion in this particular case, and why are you testifying tomorrow?
I'm testifying that Mr. Wilson reports several head injuries in his years before this crime, and that as a result of these head injuries, he sustained some in addition to a psychiatric disease, some of his behavior is explained by his head injuries, his impulsiveness, his unregulated emotion that gets acted upon without any kind of checks and balances by his frontal lobe.
And what do you base that conclusion on, doctor?
Mild atrophy of his anterior temporal lobes, which is where his amygdala is, which is part of his limbic system. The very mild atrophy of his frontal lobes with the loss of DTI in the left frontal lobe. As well as I don't think anybody's going to argue that that's not his behavior.
How do you know that's not his behavior, doctor?
That is his behavior.
Okay. How do you relate that back to October 7th of 2019?
The first murder when he basically killed the first girl after she laughed at him or something. I don't know the details. I wasn't there. But when I read that basically she laughed at him during sex and he lost and he killed her then. Then he jumped in a Jeep and he found somebody else and killed them too. Sons of someone who got very angry without control of that anger and acted without any sense of responsibility or consequence.
Okay. Are you familiar with the facts and circumstances of this case, doctor?
As far as I just said they were, but I'm not. We need to go back and see exactly what he did. And I don't actually have I need probably trial stuff to see what he's actually convicted of.
All right. Just let me take a brief moment. Hey, doctor, I don't have any further questions for you this afternoon. I want to thank you very much for taking the time.
You're welcome. See you in the morning.
Yeah, I don't have any questions.
Did someone want to ask about read or wave?
I won't have time to read it.
Okay.
Andreas, are you asking it to be typed?
I will, and I do.
And you have something tomorrow?
Yes, sir, we do. 9 o'clock in the morning.
You need it by 9 o'clock in the morning?
Yes, I do.
And where will you be at 9 o'clock in the morning? So I know where to take it.
I'll be in courtroom 7B.
Mr. Shirley, did you want a copy?
I suppose I have to. Yes.
All right. Thank you very much. I appreciate it.
Thank you. Doctor, thank you very much.
Thank you, doctor.
I'll see you tomorrow morning. Are you going to have anything to bring with you, like thumb drive or anything?
I'll bring a thumb drive.
Okay, that's fine. Thank you.
Welcome.
All right, guys.